Jackson.
And I'm Sarah Moreau, and you have joined us for Acorns to Oaks.
Welcome. All right, Nurse Sarah. What accommodations should be included in an IEP or health plan?
So you are the expert on IEP, but I will discuss the health side, right?
Yes.
So anything that child will experience in their day needs to be accounted for. So that means medication administration. That means maybe breaks. How is feeding going to be done? If we have a feeding tube, I really think that child should be included at the table because they are indeed eating a meal, even if it looks differently than the way the other children are eating, for example.
I love that.
Yeah, I think there's, I heard once a push to, feed them in the bathroom so that the other kids won't get upset. And I think, come on. Like,
Yeah.
include this child.
Yeah.
And I think that's really what it comes down to is inclusion, right? So how can we help this child to be successful in an academic sense, also in a social sense, and have a regular life experience in the community as best as they can? I think that should all be included in the IEP. So we're talking about oxygen administration if needed, medication, feeding, any sort of skin care for certain kids that have skin needs, wound care if that does occur. Sometimes you might need a one-to-one nurse. It really just depends on what the needs are of that child.
True. And a safety plan always.
Absolutely a safety plan, what to do if, and the preparation to carry that out.
Yeah. Inclusion really is important. And I see sometimes that medically complex individuals are being excluded from things like field trips because they're like, then we don't have a nurse to go with them. It's like, well, then get a nurse to go with them
If
because
this is part of their education, they need to have access. Agreed.
yeah. And so things like that should be included in the IEP, frequent breaks, where the child should sit, maybe preferred seating in the classroom.
Mhm.
Nursing services
Mhm.
should be negotiated into the IEP, or a safety aid should be negotiated into the IEP.
I think a discussion on communication as well. How are we communicating what happened in that child's day to the caregiver taking over when they pick them up?
Yeah,
And
communication buff that goes back and
so
forth.
important.
Yeah,
Yeah.
especially with the nurse or
Mm-hmm. Yeah. Yeah.
because things happen, even with the G tubes or
Yeah.
like a button or, a trach
Mm-hmm.
or any type of medical equipment. There needs to be ongoing active communication between the school and the parent.
And documentation of any medication. Things really need to be followed so that we are all making the best decisions we can. Yeah.
But take the time to get a letter from your doctor
Mm-hmm.
stating what he or she feels will be important accommodations. A lot of times we do that. We get the doctors to write us notes for the IEP process that say he needs certain accommodations, like so he needs one-on-one to be with him throughout the day for attention and safety reasons. He needs toileting care.
Yeah. I was going to bring that up
Yeah.
as well. Yeah.
So someone to be with him in that. They may need headphones,
Mhm.
right? For sensory issues. So the doctors a lot of times will write those notes as well.
Mm-hmm.
One thing that really irks me in the IEP process is so often there's the school nurse and we're dealing with a child that might have complex medical issues, comorbidity with autism. And the nurse will be impact of disability, and they'll be like, there's no physical impacts of autism on the child, the nurse's report will say. And just, every time I hear that, I just think, we need to do better there.
I think we do need to do better. I'm actually very curious, as I've never really been involved in the school system as a nurse,
Yeah.
what that assessment looks like and what that really comes down to. I'll have to reach out to someone I know for
I
more
think
information on that.
That assessment just means they're going to talk to the parent.
Oh, really?
Yeah. They don't run any formal assessments that I know of, but I think a
Huh.
safety plan, medication distribution times, that should be gone over, allergies,
Absolutely.
toileting care,
Mhm.
cleaning of materials, breaks if needed. Some of these teachers are like, they cannot have a break. I was like, He needs a break.
Yeah.
Yeah. So I would recommend putting breaks into the accommodations as
Mhm.
well if you see signs of distress. Um, and then also equipment
Mhm.
such as if they want to play during recess, they might need a adaptive bike. They might need a walker,
Mhm.
um, which I think is a really good thing.
Yeah.
Uh, but I have seen schools be like, "Well, they'll just be in a wheelchair all day." It's like, well, that's not really
That's
in
not
their
really inclusion,
yeah,
right?
not really
Yeah.
in their best interest, if
Mhm. It's
so
depending on the situation too, different kids have different needs, but I think the idea of just being present is not really the same thing as being included.
yeah.
And to facilitate the needs of that child so that they can be included, I think that should be part of the IEP process. But I am no expert on the IEP. I don't know if you can add some more to what you have observed in terms of health within an IEP and how we can advocate for our clients.
I feel like I'm a board certified advocate in special education, and I feel like the nurse just kind of glosses over that part of the IEP the majority of time.
Yeah.
But I do think the parents need to pay special attention, make sure you have any allergy needs, any medication needs, any of those distress signals need to be documented so everyone is aware, a communication book, preferential seating, taking breaks as needed,
Mhm.
and then the adaptive equipment. If the child is capable or the adult is capable, like
Yeah.
that goes a long way.
Is the nurse always included in the IEP or just
Yes.
yes? So there should
Mhm.
always be an
Yeah.
assessment, whatever that looks like,
Yeah,
from the
and
nurse.
usually it's a vision and hearing assessment
Okay.
is what they do. Um, as well, which I think is great. I remember being, in elementary school being tested for vision and hearing.
Yeah.
Yeah,
Yeah, I
so
remember that too.
it's fun. How do caregivers prevent burnout while managing complex medical needs of a child that has
So
autism and comorbidities?
amazing question. I really have to hand it to all the parents out there. That is really challenging. Ideally, all families should have access to some sort of respite care where they are given a break. Um, what should be and what is, however, is quite different. I think that I know that there are families that I work with that still are struggling to find any sort of respite at all. They may be offered the service, but it takes a lot of trust to leave a medically complex child with someone else. And I don't know that there's a lot of training for our respite teams in terms of how to follow the safety plan, how to be involved in medical needs of a child that has a lot of medical complexity. So I know that that has stopped some of the families that I work with from receiving those kinds of services. And then the stress levels are so high
They are.
because we're not just thinking about how hard it is to get through the day. There's always that constant worry of what will the future look like for my child?
Yeah.
And what can I do today that will improve that outcome down the road? And that is an unbearable weight when you really look at all the things that these parents are carrying. Um, Another area that I think we could really improve on, we could really do better in terms of respite care for these families.
Yeah, because the breaks are just as important as the active work.
Absolutely.
That's really what it comes down to is like taking small breaks, medium-sized breaks,
Mhm.
and big breaks as well.
Yeah.
Because no person, no matter how great you are as a caregiver and how much love you have, um, even the best caregiver in the world needs breaks from
Yeah.
time to time. They need to step away.
Absolutely.
Because what happens a lot of times, our parents are so devoted, and they are, and they're so courageous and
Mhm.
strong, and the love they have for that child is enormous, and, it makes your heart swell when you're talking to them or in their presence sometimes, and, but you can tell they're tired, like, they've been up all night, and
Yeah.
a lot of times, they're also working a job,
Mhm.
as well, so
Yeah. Yeah, and when are they getting those moments that are for them? When do they get to exercise and take care of themselves
Yes.
and focus on their rest and their health? I think that their health really does suffer. In fact, there is research that shows that they have an increased risk of chronic illness and an increased risk of acute concerns as well because of the stress load and because they don't really have the capacity to do all of the things they need to do for their child and then also the things they need to do for themselves. So they often sacrifice their own health, which is really sad. And I think that really kind of falls on us as a community. Um, to work together to help these families. But again, we have that siloed system, right? Where you go to respite if you need respite, and you go to behavior if you need behavior, and you go to the primary care if you need your checkups or your specialists, right? These things don't seem to work together, unfortunately. And it would be really nice if we could find a way to connect all of these areas of care.
Yeah, because I think it really is the responsibility of the insurance companies to provide parents with us. You
Yeah.
shouldn't have to quit your job because your child has a developmental disability. That is the
Yeah.
opposite of inclusivity, and that should never be. That's a
Yeah.
horrible system
Mhm.
where these insurance companies are not providing nursing care and not providing a equipped bed or a
Mhm.
Hoyer lift or something like that, which is vital to the basic care of the
Mhm.
individual. And that's why I call upon the regulators to really come in, because it can be a very tough situation where they
Yeah.
burn out, where they're just burnt, where they collapse,
Yeah.
or emotionally, or from stress, or from not sleeping.
Mhm.
And, I think we do our very best to lift them, focusing on as
Absolutely.
many
Yeah.
positive learning experiences and reinforcing experiences as possible. And some of our parents are amazing. They're so awe-inspiring.
Yeah, they really are.
Yeah. But they do burn out, and
They need support, but you're
yeah.
absolutely right that the funder part of this can really, deter them from accessing the things that they need. And I totally agree we need policy change to advocate for these parents and for their families. Yeah.
Yeah, and for people to come in.
Mhm.
Yeah, absolutely. What are the biggest mistakes professionals make when working with medically fragile autistic children or medically complex individuals? Let's keep it in the realm of ABA,
Yeah.
because we
Yeah.
have seen some mistakes. I mean,
Yeah.
first and foremost, arrogance. You
Yes.
think you know,
Yeah.
but you don't know. Back
You
off and ask the nurse
exactly.
immediately. Yeah.
Exactly. And read the room in terms of stress levels. How are
Yeah.
we doing today? Is this really a day for a lot of parent education? I think other mistakes that ABA professionals can make are subtle, making a comment, making a face. I think parents are very um, sensitive to how their child is perceived. Um, and a lot of the things that these children have to go through can be um, unpleasant.
Yeah.
Not everybody, certainly in ABA, are trained in how to handle a lot of the bodily situations that these kids experience. And so if you make a face or maybe make a comment about something looking different or um, that can come across as judgmental or
Oh,
can
so
come
does.
across, yeah, it's really um, unacceptable. And I know we're working really hard to make sure that our staff are aware before they go into homes of their nonverbal communication and also bringing any concerns that they have to their behavior analyst, not directly to the parent,
Or the nurse.
or the nurse.
Yeah.
Yeah, because that's part of working as a team. And it's part of, maybe there are variables with this child that the therapist might not understand. And so having that discussion internally first before we do it collaborating as a big team, I think does help with some of those miscommunications.
Yeah. I think a lot of times well-meaning behavior therapists are like, my cousin has epilepsy. Well,
Mhm.
you need to back off, because there's a big difference between knowing about and knowing of, or living experience of something.
Absolutely.
And then stay within your scope. Just
Yeah.
let the nurses lead the team.
Mm-hmm.
Don't make comments about medical procedures. Don't
Mm-hmm.
give your opinions. Just let the nurse do her job, and
Mm-hmm.
she will let you know,
Mm-hmm.
okay, he's ready to go. Like,
Yeah.
they'll let you know when to restart or to
Yeah.
begin this session.
Yeah, and I think it's also good to get into a rhythm in terms of, okay, the nurse is coming in to do some toileting or a diaper change or whatever procedure. That's a great time for the therapist to step out and give privacy. Um, I think sometimes professionals can feel like, well, this is my domain and I'm doing this work, and so I'm going to stay right here until they're ready to continue. Well, sometimes that's not as respectful as you should be in that kind of situation.
Yeah. Giving privacy, unless there is a plan for you to support that nurse.
Through behavioral issues.
Yeah, through
Mhm,
behavioral issues. Like, we had a little one who had a trach,
mhm.
and he kept poking the trach, and he was causing harm.
Yeah,
And so we did have to assist the nurse in some behavioral strategies while she did other things, but
yeah,
that was talked about and agreed upon beforehand.
absolutely.
So I think that is really essential. I think the biggest, most arrogant thing that you can do is saying, well, I know because my cousin's friend has autism
Yeah.
epilepsy, or I know because you don't know.
Yep.
And you need to check your experience at the door and kind of sit back, listen, and watch these routines and learn the flow of the house and
Mhm,
learn, okay, when is good time to run session and run programs and when is not. And
mhm.
the people in the house will kind of let you know of the routine and say, okay, he's all set to go. And they'll, like,
Bring him back to
yeah, they'll bring
session,
him
yep.
back in session. And so,
Yeah.
um, and then not to ask overtly amounts of questions. You don't need to
Yeah,
know everything about their job because you don't need to do a nurse's job.
and
You know,
yeah,
like, what's that? What are you giving him? Like, those types
yeah,
of questions can also come off as extraordinarily arrogant from a clinician.
yeah, it can be really distracting as well if you're trying to do your work and if that work requires some sensitivity, which I think most nursing work does, to be answering questions about, well, what's that and what's this for? And, is not necessarily helpful. Um, I also think that in communication with parents, um, a mistake that I witnessed once was someone asking, well, did they ever walk? Could they ever do these things?
Yeah.
And asking questions about ability from the past can be so traumatizing. Whether or not, the answer is yes or no, it doesn't matter. And it certainly doesn't matter for our behavioral intervention in that time. So I think a lot of those mistakes are made when therapists are uncomfortable and they feel like they need to say something, when sometimes the best thing you can do is just be quiet, be present, and be supportive.
And watch
Yeah.
and look and listen and learn,
Yeah.
so that you can better gauge the flow of the environment, right? Because that's what behavior analysts are really studying, is the environment.
Absolutely.
Yeah.
Yeah.
Sometimes we get medically complex cases where the nurse is not there.
Mhm.
And so sometimes if a patient is coming out of having an operation, like,
Mhm.
let's say they got their adenoids out or something like that, we might use a simple pain scale, which is pretty universal.
Mhm.
And we'll just say, how are you feeling today, to gauge the amount of pain they're in from the very start of session so
Mhm.
that you can then either lighten the session load, have more
Yeah.
play-based session. Um, and I think that's a good rule of thumb if you have any type of TBI, traumatic brain injury.
Yeah.
We have a
Yeah.
patient that had TBI and can get headaches. And so it's really important for him to identify where he's at in pain tolerance.
Yeah.
Um,
And that's a skill as well. So there are a number of pain scales that you can use. So for example, if you have um, a nonverbal child or a baby, for example, in the
yeah.
hospital, we might use, where we just kind of gauge based on their nonverbal communication, how much pain that we think they are in. if we have faces, right, which is, I think, one that most people are
Yeah,
familiar with,
the faces,
which,
yeah.
most commonly used for children, but we have to train them on that too,
Yeah.
because I've had clients in the past that I know are not feeling well, but are pointing to the happy face because that's the good one, right?
They're like,
So,
"I get happy faces at kindergarten, so I
right,
want
I
happy
want the
face."
good one.
Yeah.
I want the happy face, and I want the happy face for them too. But I think, making sure that they understand the question that we're asking. And then, of course, there's the numbers, right? That's
Yeah.
most of us adults are used to if we're in the hospital, of the
Yeah.
scale of 1 to 10. Um, and it's really interesting, little sidebar here, but a lot of the pain management is based on that number, right?
Yes, I know.
So, right?
Mhm.
Again, like, treatment is affected by that response, and
It's so funny
pain.
you say that because my husband was in the hospital and, he had just gotten he said the nurse came in and was like, "On a scale of 1 to 10, how much pain are you in?" And he was like, "A 6," and then they, like, shot something up his arm.
Yeah.
And then he said, "Remind me to say 6 again next time." "Okay. Alright."
Hospital
Like,
experiences, yeah.
"I'll say 6 again. Remind me if I forget. Tell me to say 6."
And I really am glad that he's doing very well today,
Yeah,
by
he
the way.
is, yeah. Yeah,
But
but that
yeah,
was
yeah.
funny.
So it does affect treatment, and we are taught as nurses that pain is subjective. So I
Yeah.
even though I may use a scale for a baby where I just look at you and kind of determine, yeah, it looks like this much pain. In adults, we won't do that. We'll just accept what you have to tell us because I can't tell how much pain you're in. I don't physically know. Um, so I think it's really a good skill for our medically complex clients to have because they'll probably encounter something similar throughout their life, depending on their health and procedures that they have to experience.
Yeah,
Yeah.
and I think it's really important that behavior analysts in their program teach skills like discriminate hurt versus sick,
Yeah.
right?
Yeah.
Like, we need to teach these things, and we need to teach them with multiple examples over and
Yeah.
over again.
Yeah. It's
Yeah.
so important to be able to communicate those things.
Yeah,
Yeah. So
and that's the most frustrating thing I hear from parents. It's like, "I'm so tired of playing the guessing game." I think that's one of the most exhausting burnout things for parents is
yeah.
when they're playing the guessing game, like, "Do you want TV? Do you want this? Are you done eating? Are you
Right?
full? Do you want more?" Like,
Yeah.
you know,
Yeah.
when parents play the guessing game, and then we get that communication flowing, and they're just so relieved that they no longer are playing as much of a guessing game as they
Absolutely.
were.
Yeah.
Yeah. So the pain scales can work, but you have to train on them.
We have to learn it. Yeah.
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 As an adult, I went into the urgent care once and I said, "I have a horrible stomach ache." And they're like, "What's the scale, pain scale?" And on a scale of 1 to 10. And I said, "A 9." And they said, "We're going to give you a shot of morphine." And I was like, "You know what? I'm feeling better. I think it's more like a 3 now. I don't think it is like a 9." So you're right.
Yeah.
Pain scales
Yeah.
can really,
Yeah, they
don't tell
affect
them
treatment.
9. Like,
Yeah,
yeah.
for sure.
Yeah.
Yeah. Yeah.
So very subjective, but a number
Mhm.
that works. So
Yeah.
yeah,
Yeah. And it should affect our treatment as well. And I think it does when we know, hey, he's not feeling great right now.
yeah,
We're gonna do maintenance tasks for a little bit. We're gonna hang out and do some stuff that I know he does well.
we're gonna play some games.
Play some games. Yeah.
Yeah,
Engage in stuff that's fun.
silly.
Yeah.
Yeah, get his hands going, get his
Yeah.
mind off of it.
Yeah.
Yeah.